Hi, everyone. Jody Heiss here with you, bringing you another edition of the Freedom Caucus podcast. Welcome aboard. So glad to have you joining us today. And of course, the coronavirus continues to be the news of the day, sucking all the oxygen out of every newsroom and, quite frankly, out of every living room across the country, as it is the major issue of concern all across this country. We are in the first week of April. And of course, this begins 30 days to stop the spread. And so we are in the midst of a crisis from which we are getting advice from medical experts, and that information is driving the decisions, rightfully so, right now, as to what's taking place. But this virus is impacting us on two fronts. Obviously, the health issue concerning our nation, but also the economy and the impacts that are taking place on that front. Joining us today is an individual who, frankly, is uniquely equipped and qualified to address this issue. Dr. Jeff Colyer is both a surgeon and a statesman. He is the 47th governor of the great state of Kansas. And so he brings to this whole argument the political side of things, the knowledge of the economic side of things, but as a doctor who is still actively involved in medicine in Kansas, he's obviously is able to bring that. Now, what is so powerful about Dr. Colyer, last week he and a colleague penned an op-ed, in fact, an op-ed that Rush Limbaugh read word for word on his program last Wednesday. It ran in the Wall Street Journal. It was entitled, "These Drugs Are Helping Our Coronavirus Patients. The Evidence is Preliminary on Repurposing Two Treatments, but we don't have the luxury of time." He, of course, is referring to the two drugs that the FDA has approved to be utilized right now. So he has become a leading voice on every issue as it relates to the coronavirus pandemic. So, Dr. Colyer, first of all, thank you so much for joining us on the Freedom Caucus podcast. We're extremely honored to have you here with us.
Jody, it's great to be with you, and it's so important that we get good information out to people. And I appreciate, all of your hard work in doing this. I just wish we didn't have to be talking about this topic.
Yeah, it's amazing how rapidly this thing has come upon our country and the world for that matter, and the impact not only from a health perspective, but from an economic perspective. And that's been one of the things that I personally have been talking about all along. We've got to be able to thread the needle between addressing the health issue of the coronavirus while at the same time addressing the economic ramifications that it's having in our country. And the way to do that, the way we deal with the economy, is to address the problem. And the op-ed that you came out with last week, let's talk about these two drugs that are having an enormous impact. What are the drugs? What kind of impact are we seeing on a positive side of things as it's relating to the coronavirus?
Yeah, it's a really frustrating and scary time. But, while it seems like we're looking forward into doom, one of these days we're going to look backwards in awe at all of the things that Americans are doing together to beat this. And we are going to win, but it's going to be a tough fight. One of those ways of fighting right now is we discovered two medications called hydroxychloroquine and azithromycin, or a Z-Pak. Hydroxychloroquine is a drug that's been used in the United States since 1955. It was first used to prevent malaria and treat malaria in Vietnam. It is also used commonly for people with arthritis and lupus, immunological diseases. And there were some CDC studies a few years ago that found that it actually inhibited and killed the virus in lab studies. And in China, there was a doctor there who had 80 patients who were on this medication, and none of them came down with the virus. So that raised a lot of eyebrows for us. And now we're using it here in the United States. The FDA has now approved it after we've had two op-eds that have been out discussing the evidence on it. And I think it's something that we need to look very hard at, but is looking promising.
Now, where is it currently being used?
So right now, there are people using this around the world. There's a very big study going on in France and here in the United States. So many major medical centers, Mass General, the University of Washington, the University of Kansas, and many private practitioners use hydroxychloroquine for patients that have been tested positive for the coronavirus and are having symptoms. There's two ways of using it. There's one in the early stages, which is most of the data right now suggests, and you should think of this just like cancer. You treat it early, you do better. There's a lot of data that suggests the earlier you use it, the better results you have with it. And we have about 6 different studies from around the world, and there are ongoing studies here in the United States. And what we're doing is we're actually watching science in real time, and there are going to be steps forwards and backwards. But these
Remarkable.
drugs, yeah,
It really is. So,
and
are the results being globally pretty much the same? I mean, I heard about the 80 in China. Are other parts of the world seeing the same positive results?
yeah. So in France, there was a study that was released a week ago where 78 patients who were hospitalized, were sick, were treated with this combination, and of them, all but 2 went home much faster, did not go on to a ventilator. There were 2 people, one who was already on a ventilator and a very old patient who was very, very sick when they came in, that passed away. But those were very promising results. There's now a Chinese study that was just released this week where they had 62 patients. Then half of them they put with the medication and half without. Those with the medication, those who received the medication did better, shorter time to feeling better, less cough, less viral load, and fewer people requiring to go on into the hospital or on a ventilator.
So that was the placebo test, and actually there was obviously a huge difference with the medication.
There was a big difference between the two, but it's also a small study, 30,
Right.
30 on each side. But this is an important step. It's really the first controlled study, and we may find instances where this isn't the appropriate combination, or it may not be for every patient, and that's what we're learning. But we've got to learn fast.
We got to learn
And
fast. Exactly. That's the way to cure the economy is to remove the
exactly,
fear that people have for going to work, getting out in public, and you remove the fear by coming up with something that helps address the problem if you're going to get it. And this is an enormous step forward. Now, in addition to the medication, we of course have had a huge push across the country to the point of shutting our country down virtually for social distancing. How important is social distancing as it relates to the spread of the coronavirus, and is it helping? Do we have that kind of information?
yes, it does make a big difference for us. I've worked in about 30 different war zones and in dozens of epidemics in places like Syria, Afghanistan, the Rwandan genocide. And the social distancing part is important because you want to slow down the number of people that get infected. And this is one where uh, the virus can be carried through cough, through touch. And so it's important to have that, what we call social distancing now. And that slows down the spread so that we can isolate and treat the people who are sick with this. I'm hopeful that we can get a vaccine sooner rather than later. That could be very helpful for us, and that's what will help us in the long run.
Well, absolutely, it'll help in the long run. In fact, that's That's a great question. We're hearing a lot that this virus could be around for a long time, and so what do we do for the next several months? Obviously, having a vaccine would dramatically impact where our country goes with this over the next few months. But what can we expect over the next few months, and how would that be impacted by a vaccine? And what kind of time frame are we looking at for a vaccine to be available?
So let me answer both of those questions for you. We've seen a lot of those reports where you just see this great big high pitched curve, and lots of people die in the space of 6 8 weeks. When I say lots of people, millions of people, 2 million people. By the efforts that the president, the governors, and local people have done, we've cut that risk down tremendously. We're still talking a huge death toll. We're still talking 100 to 200,000 people. But what's most likely, by the social distancing that we've done, that as the summer comes along, many people believe that the virus will still be in the environment, will still have deaths, but it will slow down. And the big thing is we get smarter. That's who we are. And so over the next few weeks, we get this to come down. We figure out new ways to work, new ways to be on that factory line. What kind of protection do we need? And so I really kind of see it as two major humps, or maybe even a few ping pong ball bounces. Think of it that way, as different states come online here. But the idea is that if we can get things under control here early in the spring, get on through the summer, we're going to modify how we work. It's just going to happen. And then hopefully later on, the end of the year, we might have an option for a vaccine. I've talked to a lot of vaccine companies. I'm actually working with one, and there are a number of fantastic technologies that are out there. And I think, that policy of all of the above, we need to go and chase several of these different vaccines so we can get people vaccinated and get them back to work.
So you think that could actually happen by the end of the year?
There are some people that think we can. I've seen some models of doing that. The traditional thought is they take 3 or 4 years. Then there's more data that says, we're going to rush everything, get 18 months. And this is also kind of a Manhattan project. And if you can manufacture the vaccine at the same time that you test it, that gives you some lead time. But you probably have to have 3 or 4 companies making vaccines at the same time and testing vaccines to get the best one or to get enough coverage. Those sorts of things would shorten the time to actually get Americans protected.
Wow. Well, while you were serving as lieutenant governor and governor of the state of Kansas, one of your primary focuses was actually on rural healthcare. And of course, now you find yourself in an incredibly important position on the National Advisory Commission on Rural Healthcare. One of the main focuses of that, and much of my personal district, the 10th District of Georgia, is rural. And I know the importance of the telehealth care. Tell us a little bit walk us through about telehealth and how that can be a major part of help for people, particularly right now with this pandemic.
So overall, I think we have great doctors, 1,350 critical access hospitals in rural America. There's about 60 million Americans that live in rural America. And this is a place where we actually could have some pretty rapid transformation, and you're going to see that happening right now. Telehealth is one of the big ones. Telehealth, where you can actually talk to your doctor and their nurse, and maybe even a specialist, through the comfort of your home, or you might be able to go to a rural center and then be able to talk to a specialist that might be in Texas or New York or Kansas. And those technologies are rapidly being adopted right now. What those technologies can do is actually it can make medicine a little more affordable and help us get better care. And the other thing I think it does is I think it values people's time better so that you don't have to wait for hours in the doctor's office. I think we'd all be happier with that.
Well, and another thing, just thinking off the top of my head here, it helps with not putting so many doctors and nurses and medical professionals on the front line of potential risk, since that's going through the telemed. And one of the big issues, of course, we're having right now is the PPEs, the personal protective equipment. Is it normal for us to have shortages of masks and gowns and all these different things in the healthcare industry? And when do you anticipate that we're going to see that particular issue resolved?
In normal times in the United States, we typically have plenty of PPE, personal protective equipment, as you call it. And every hospital probably has, a few weeks worth for normal operations here. I've worked in 30 conflict zones, and every disaster that's mass like this, there comes a time at right after the beginning when you run out of resources. And this is a common one that happens. I think people are mobilizing very quickly here in America. They're mobilizing to manufacture more here in the United States. I'm excited about that. There's been multiple efforts by every governor, by major corporations, and by the federal government to obtain more from foreign sources, where these are manufactured largely in Asia and some in Europe as well. And obtaining those, the prices go up because there's lots of demand and little supply, but lots of people are coming online with additional equipment. So what we have to do in the short run is improvise. How you use it? Can you reuse it? How do you re-sterilize it? Can you shift who needs which kind of equipment? So not everybody at home needs an N95 mask, but those doctors on the front lines do. Or converting MOP gear, those M40 gas masks that you've seen, those are actually a biological protection. You could even use those, even though they look scary, for frontline providers. So we have options, and people are using all of those options right now. And we're going to see some shortages, but I think give it a few weeks, and the power of America and the American economy will produce a large amount, and hopefully we'll be swimming in this before too long.
I certainly hope you're right. Dr. Jeff Collier, what a great honor to have you on the program. As a parting word, and we've got about 2 minutes left, what would be your parting word to our viewers, our listeners? Obviously, we've got to stay vigilant, but if they have symptoms, I guess part of it, what are the symptoms? What would one expect if they are coming down with the coronavirus? But what should be their first step of action if they do have some of those symptoms?
Sure. So when you're in a rural community, you know who your doctor is, or you may not. It may be a ways away. But the symptoms that are common are fatigue. You feel incredibly tired. Maybe a fever, but not everybody has a fever. A new cough that may be kind of a more drier cough, but that varies quite a bit. Or shortness of breath. Those are the most common things. If you have those symptoms, what I would suggest is you call your doctor or call the emergency room. Don't drive there. Call them first. Talk to them. What they'll do, and it actually sometimes it may take a little bit to get all the way through, but what they'll do is they'll look at your medical situation individually and direct you. Do we need to get you tested now? Here's what we believe is the closest place to get tested. Maybe we need to have you come into the emergency room because you have, a significant medical problem. But if you are, they want to guide you how you get through there so that you don't contaminate all of the other patients there. So talking to the hospital or talk to your provider is really the best thing to do with it. And, and just be calm and straightforward. Things that you can do at home, lots of fluids. Tylenol appears to help with fevers with this, and those are kind of the two mainstays, for right now for getting through at home. You can talk to your doctor if you test positive about the options of hydroxychloroquine and a Z-Pak, and you and your doctor can work that out, and what is appropriate for you.
Great advice.
But I'll tell you what, the last thing though is we are Americans. We're all in this together. We're going to come out of this stronger. It's going to be a tough road, and there's going to be a lot of twists and turns. So I ask for your prayers, pray for our country, pray for ourselves.
Absolutely. Dr. Jeff Collier, thank you so much for joining us. Folks, that's all the time we have today. So thank you, all of you, for joining us. We'd encourage you, I know you liked this and got a lot out of the program today. We'd encourage you to rate, subscribe, review to this program. You can do so on iTunes or SoundCloud, and we'd encourage you also to share it with other people. You can always find out more about the Freedom Caucus on Facebook at facebook.com/Freedom Caucus, and you can follow us on Twitter simply at Freedom Caucus. Thank you again so much for joining us today. Until next time, stay healthy, have a fantastic remainder of your day, and we'll be with you next time.